Welcome back to Empowered. I'm Elizabeth Namofsky. I'm joined by Dr. Vivien Brown, family physician and assistant professor, Department of Family and Community Medicine, University of Toronto. And she's also the author of the New Women's Guide to Healthy Aging. So here we are. Let's talk about immunization. What diseases can we prevent by getting immunized?
Well, Elizabeth, this is such an important topic. I appreciate you bringing it up because the way I talk about immunization to my patients is I combine the term immunization with independence. And what does that mean? It means when you're immunized and when you prevent certain potentially catastrophic diseases as we get older, you maintain your independence because a disease like a severe pneumonia, severe respiratory diseases like RSV, which is respiratory syncytial virus, influenza. These are the diseases that can affect you so badly that you may not be able to breathe on your own, even if you survive the disease. And what we find is as we age, you're more likely to end up being hospitalized. So people over 65 are much more likely to be hospitalized with pneumonia, with RSV, with influenza, with COVID than younger people. What's also interesting about immunization is all the different data sets from the US, from the UK, from Canada have ended up looking at the risk of age-related disease and the risk if you have underlying diseases. So for example, if you're 65 and healthy, you should get a pneumonia shot. But if you're 50 and you've got diabetes and maybe COPD, and maybe you're on medication for your heart, you should be getting that same pneumonia shot at age 50. And if you have underlying immune compromising diseases like lupus or rheumatoid arthritis or psoriasis, you actually should be thinking about getting these shots somewhere between 18 and 49. So the age group changes depending on your underlying risk. And one of the reasons that's so important is because when you get a disease, and I'll use pneumonia as the example, it increases your risk of a heart attack, it increases your risk of a stroke, it increases your risk of exacerbating asthma or COPD. And the older you are, the more likely those comorbidities that maybe were stable and that you were doing fine in the community become unstable, and you end up needing more and more assistance, even a caregiver, even changing the situation where you may not be able to go home and live independently. So when you're talking to your doctor and you're looking at, oh, do I really need a flu shot? It's like, yes, you don't want to get influenza. You don't want to be on a ventilator. You don't want to end up not being able to go home and live independently. And the various shots depend on age and depend on risk.
Wow,
I
that
think,
that's a lot. That's a lot to undertake. So let's just take it to the next level. So who in my family should get what vaccines to prevent the diseases?
yeah. Well, there's all the childhood vaccines that we do a good job with in Canada. We prevent polio, we prevent pertussis, which is whooping cough. We prevent a number of diseases in infants and children. Then in adolescence, we generally are just giving tetanus and pertussis boosters every 10 years, but we also are giving HPV vaccine. HPV is human papillomavirus, and that prevents cervical cancer, throat cancer, anal cancer, vulvar and vaginal cancers. In Canada, we offer that to every boy and girl in the school system paid for by public health because we want to decrease these cancers. And in other countries, they already have done that. Our uptake has not been great. During COVID, the numbers fell off. And so we're not doing as well as we should. Unfortunately, cervical cancer is on the rise in Canada. And in Scotland, last year, they did not have a single case because their rate of immunization is so much higher than ours. So we want to look at cancer preventing vaccines, particularly in adolescents and young people. Then as we get older, it depends on our underlying disease. So people with diabetes, people with asthma need different shots at a different age than someone who, say, for example, just turns 50 and says, okay, what do I need? And when you're 50, it's a good time to see your doctor and review what shots you've had, what shots you need, and where you should be looking. We also are immunizing women in pregnancy. We're immunizing women for influenza, for COVID, for pertussis, which is whooping cough. It's going to protect their baby. And depending on the situation, we're immunizing pregnant women for RSV so their baby is protected. There also is an immunization to give babies if it's available. Right now, it is not available. So we're trying to immunize pregnant women so that their babies are protected. So every age group has a different scenario to follow, But the bottom line is we want to prevent these preventable diseases because it makes a huge difference on your health, on your ability to exercise, on your breathing, on your independence. So think of immunization and independence going together.
Thank you so much. Please don't go away. We'll be right back with more.